So let me introduce Ruth, who's going to talk about the triangle of care. Thank you.
Thank you. Hello everybody. Can everybody hear me okay?
Let me turn the mic on.
I am a bit of a shouter, so you should be alright. I'll use Tarek as my test, because he's right at the back. Okay, the presentations you've got in your pack is slightly different to the one you're going to see, but fundamentally they're the same things. I'm sure Howard will be able to circulate a more up-to-date version. So as Howard said, I'm Ruth Hannan, I'm from Carers Trust. If you've never heard of us, this is who we are. We're a national organisation. We historically we're in our infancy. We're only 2 years old, but we were formed from two very long-standing organisations: the Princess Royal Trust for Carers and Crossroads Care, who I'm sure many of you are very familiar with. So I'm the national lead for Triangle of Care in England, and I'm responsible for all areas of mental health that relate to carers, people with mental health problems or dementia. So for those of you who haven't heard about Triangle of Care, this was the kind of model of what most people experience in terms of care, and this was kind of the model that spawned the development of the Triangle of Care, which is this idea of a kind of a line of people with the professional at one end, the carer at the other, and service user in the middle, and kind of people speaking through, it's one person, but it's quite a disconnected model, nobody's speaking to each other equally, and obviously it can cause a number of problems. Carers are excluded from the care pathway at certain points. It can lead to a failure to share information with carers, but also enable them to have the opportunity to give information, which obviously is very important for people's care and treatment. And it can mean that the carer can't access help and support in their own right if they've not got that opportunity to have those conversations. So, what is the answer? It is a simple solution: the Triangle of Care. Everybody is equal, it's an equilateral triangle, whereby everybody can speak to one another equally, and the flow of information passes between each area more seamlessly. So the Triangle of Care was actually developed by a group of carers over a number of years. I'm delighted to say that originally they had 14, what they call 14 core principles. I'm quite pleased that this is now reduced down to 6, because I only just managed to remember all 6, and 14 would probably be a stretch for me. It was developed by a carer called Alan Worthington, who cares for his 2 foster sons, who are both now in their 40s. He'd been caring for them since they were teenagers, when they both developed serious mental health problems. And he developed this with a group of carers in Devon, looking at what their experiences had been over the years, and what they felt that they needed to both improve their experiences, but also improve the care that the person they were caring for received, and also the care that the professional was able to provide. It was launched in 2010 in its original form, and it was a joint piece of work between ourselves and what was then the National Mental Health Development Unit. And not long after it was launched, it was announced that the National Mental Health Development Unit was closing. And fortuitously, I came into post. And when you're new in post, you can pick what you're going to do. And I had this, and I said, oh, this is really good, we should do more with this. And now that the National Mental Health Development Unit is closing, we should take the lead and drive it forward. It's too good to become just another booklet that sits on a shelf and gathers dust, and somebody occasionally says, oh, do you remember the Triangle of Care? So when we talk about the Triangle of Care, what do we mean? What underpins it? It is a therapeutic alliance between professionals, carers and service users, both on a personal level but also an organisational level. And what the carers who developed the Triangle of Care said was, if we have these 6 standards in place, then I will feel more informed, I will be better involved, I'll be able to support the person I care for better, and they will get better care and support because of that. So the 6 standards were that the carer and the role that they play are identified at first contact or as soon as possible thereafter. Because what we were finding was that carers may have been caring for somebody for a really long time, and nobody had actually sat down and had a conversation with them and found out who they were, what their experiences had been, and what support they were getting. That the staff are carer aware and trained in carer engagement strategies. And what that means is just kind of a highfalutin way of saying that they understand what it's like to be a carer and what being a carer is. Because one of the things that we found is people have a very fixed idea of what a carer is. It's often in people's minds somebody who is helping somebody maybe do the shopping, helping somebody get out of bed, cooking for them, and they don't think about the emotional support, the help with managing medication, watching for when that person is becoming unwell. So it was really trying to get staff to have a better understanding of what being a carer was like. Policy and protocols regarding confidentiality and sharing information are in place. Most organisations have confidentiality policies, but what we find is that staff don't understand them, they don't understand the intricacies of confidentiality, they don't understand what they can share and what they can't share. So what the Triangle of Care is really testing that out and getting staff to look at what they can talk to carers about, how they can involve them. So that's one of the really key standards. That there are defined posts for carers in place. Now that doesn't necessarily mean that that person becomes the person that every carer goes to see, but it's that that person is there to make sure that the rest of the staff are feeling and being responsible for carers, that they're doing what they should be doing for carers. People call them carer champions, carer links. I kind of call them carer pests, because that's kind of what I think they're there for. They're there to pester everybody else and just remind them what they should be doing, because that's kind of how I see myself. The service has an introduction, a carer introduction, and that has a range of options across the journey. When somebody's admitted to hospital, you don't want somebody to hand you a great big weighty tome half an hour after they've been admitted. What you might want is something very simple about when visiting hours are, what the phone number is you need to call, what you can bring somebody while they're staying in hospital, who you can call, the name of the doctor, the name of their name nurse, and then a development of more in-depth information as that person's treatment progresses. And finally, that a range of carer support services is available. There are often they're all outside today. Lots of different carers organisations locally. What we find is that staff are often not aware of them, and it's important for them to know what's out there for carers so that they can make sure that carers are getting support in their own right. So they're the 6 standards, and then in the guide there is a very detailed self-assessment tool that really drills down into what those standards look like in practice. So what are the benefits for the Triangle of Care? Well, there's lots of benefits. Benefits for carer, benefits for professionals, benefits for service users. For the carer, it's that they get recognition. They are involved. And I think that's really important. People are often supporting someone in isolation, not being given enough information and support to be able to keep doing that. That they are able to give and receive information that they need that's important to that person's treatment, which is a benefit to everybody. It helps carers feel less isolated, it helps them feel part of the team, that they're being listened to and that what they do, their knowledge, is valuable, which is really, really important. Carers often have a huge amount of information about how somebody's illness affects them that isn't being tapped into. And it helps carers feel stronger and more resilient. If we're giving people the right sort of information and knowledge and skills to enable them to care for someone, they feel more able to do that. It's like, no, you don't say to somebody, right, off you go and drive a car, and don't tell them how to do it. So there are obviously benefits for service users as well. There's a more comprehensive service from ward to home. When they go home, it's really important that people understand how their mental health and their mental illness is affecting them, and what that looks like, and what they can and can't do because of that, and what medication how that will affect them as well. And that's very reassuring for people if they know that their family has that information. It reduces the need for them to repeat information over and over again. Nobody likes to have to repeat themselves. It's like being on a call centre, you know, and you get put through to the next person, you've got to start from the very beginning again, and by the end of it, you just feel like giving up. And it's really important if carers are giving that information as well, there's less chance for service users having to keep repeating themselves. And less need for a service user to act as a go-between between professionals and carers. And there are benefits for staff, and I think that's one of the key things about the triangle of care, and one of the things that we have from staff quite often is when they first see it and they first hear of it, they kind of think, oh, more work for me. This is just going to be more work. But what actually happens is when they start working on it, they realise, oh, this is really useful because now I know how to speak to Mrs. Jones, and Mrs. Jones can tell me these different things, and I understand what it's like to be a carer and how that and what that means for the family. So it has really positive experience when staff start using it. They have allies. If you're working with families and carers, then they're part of the team. They're on your side. They're working with you, and I think that's a really, really positive thing for staff. That they ensure that they're getting up-to-date information about that person's illness if they can't pass that information on themselves. Things that are really crucial to achieving good treatment plans. And I think that if you read the Triangle of Care, it's very, very straightforward. Most carers, I think there's a couple of sort of terms that have become constantly sort of used about Triangle of Care by carers now, and it's just common sense, isn't it? It's just common sense, because it is quite a straightforward idea and quite a straightforward model of doing it. And I think that's been a really positive thing. But it enables carers to see what they should be experiencing and what they should be receiving from a service. So what that actually looks like for them is that they're kept up to date when somebody is admitted to hospital. They're told about what it all means. I think when we work in mental health services, you forget that actually most people do not know anything about mental health services. They don't really know nobody really knows what a psychiatrist does. Sorry, psychiatrists, if you're in the room. Nobody's really sure what a social worker does. What does an occupational therapist do? All of these things, people don't automatically know them. So if we're actually explaining that can help them understand what that experience is going to be like for that person in hospital and reassure them as well. The people feel listened to. That's really important. We all want to be heard. We all want to be listened to. And that's really important. We want to feel welcomed. We want people to engage with us. I go to a lot of hospitals and I like to test out how long it goes for me to walk through a hospital and how far I get before somebody actually speaks to me. And you can go quite a long way before somebody actually speaks to you in a hospital. And if you go onto a ward, that shouldn't be the case. People should be speaking to you, they should be engaging with you, they should be reassuring you and making you feel welcome. Especially in a psychiatric hospital, people are quite scared of them, they don't know what they're really like. So to actually make that reassuring for them is really positive. Knowing who's available for them to talk to. It means that they're not having to ask 10 different people. They can just say, can I speak to Bob? And then somebody can find that person. Having somebody who they know is there for them to pass on information, ask questions, is really important. Knowing the name of the psychiatrist, the lead nurse, the care coordinator. These seem really simple things, but it doesn't happen for people. and I think that's really important that it does. And being told about services for the whole family, I think it's quite often forgotten about. I think, again, this sort of idea of care awareness, that there's just like one person in the family caring for another person, and then everybody else, I don't know what they're doing, maybe sitting in the garden drinking cocktails or something. But it actually, it's everybody, it's a team effort. So how are we supporting that whole team of people? If there are young carers and children in the house, how are we making sure that they understand what mental illness is, what mental health is? How are we making sure that they're looked after and supported? So we created a membership scheme, and that was something that we wanted to do to recognise those organisations who were doing a lot of work on triangle care, and also to push organisations to take a more formal step to implementing the triangle of care. So it's a fairly simple thing. People have to self-assess all of their services. They do it in 2 stages. Their inpatient services and their crisis teams are the first stage. They have to self-assess all of those, create action plans, and work towards change. I mean, when they do that, they get a lovely shiny gold star. I think people like to tap into their inner primary school feelings, and everybody seems to really like gold stars. And then after the second stage is that they self-assess all of their other services. And it's quite a big job for some people. One of the trusts that have signed up have got 92 wards, and they have been doggedly self-assessing their 92 wards over the past year. But it has been a very positive experience, and I think that the important thing is for them is it gives them a much clearer picture of what's happening on the ground as opposed to what their policies say. And I think that's been one of the biggest things that has come out of Triangle of Care, is really capturing the experience and the difference between what a policy says is happening and what a procedure says is happening and what people are actually experiencing. Skip past that one. So the membership scheme, we've now got 26 mental health trusts signed up to that. The idea is that once they've self-assessed and got their gold stars, that's not the end of it. This is a long process. I've started to refer to the Triangle of Care as a marathon, not a sprint. Because what we're fundamentally trying to do is change the culture of an organisation. We're trying to say, okay, you say that you work with carers, you say that you include carers, but you now know that that actually isn't happening as well as you thought it was. So you've got to start looking at how that can happen. And lots of things come into play to make that hard and make that challenging, and cuts to services and restructuring and all those wonderful things that get thrown into the pot. But if an organisation truly commits to Triangle Care and think, in 10 years' time, we might be there, carers, staff and service users will have a fundamentally better experience. Thank you very much.
Thank you.